Despite overwhelming evidence linking obesity to an increased risk of at least 13 types of cancer, including some of the most lethal and commonly diagnosed, such as breast, colorectal, endometrial, pancreatic, and liver cancers, national cancer prevention strategies continue to treat obesity as an afterthought. In policy frameworks around the globe, obesity remains framed as a vague lifestyle issue rather than a modifiable, biological risk factor central to cancer pathogenesis. As a result, funding allocated to obesity prevention and management within cancer control programs remains disproportionately low, especially when compared to its epidemiological impact. This omission is not just a missed opportunity, it's a critical policy failure that undermines cancer prevention efforts and deepens health inequities. Cancer prevention funding tends to follow visible, immediate threats: smoking, infectious agents like HPV or hepatitis B, environmental toxins, or genetic predispositions. These are tangible targets with historically well-funded, high-profile campaigns. Obesity, by contrast, is viewed through a fragmented lens, part public health, part personal responsibility, and often siloed under chronic disease management rather than integrated into cancer prevention itself. This artificial separation ignores decades of scientific progress showing that excess adiposity is not simply a comorbidity, it's a driver of tumor initiation, promotion, and progression. Policymakers often cite the complexity of obesity as a reason for inaction, claiming it is harder to regulate than smoking or pathogens. But that logic falters under scrutiny. While it's true that obesity has multifactorial causes, so does tobacco use, which has been the subject of coordinated regulatory efforts for decades. Sugar consumption, ultra-processed food marketing, food deserts, sedentary infrastructure, and weight stigma all play roles in obesity prevalence, and each of these factors is amenable to intervention. The real reason obesity remains neglected in cancer policy isn't scientific ambiguity. It's political discomfort. There is a reluctance among governments and health agencies to confront the food industry, regulate advertising to children, restrict harmful additives, or subsidize access to fresh produce and active transportation. These measures, while effective, require confronting powerful economic interests. Cancer prevention campaigns that address obesity would necessarily require systemic changes that challenge the status quo of the food economy. But the cost of avoidance is steep. Projections show that by 2040, obesity will overtake smoking as the leading preventable cause of cancer in many high-income nations. Yet funding levels and national cancer plans don't reflect this looming shift. Even within major cancer research funding bodies, obesity is vastly underrepresented. A recent analysis of grants awarded by major public agencies found that less than 2% of cancer prevention research focused explicitly on obesity, diet, or physical activity, despite these being among the most modifiable risk factors for many cancers. Prevention strategies remain overly focused on screening and early detection, valuable tools, but downstream in the disease process. Investment in upstream prevention that tackles obesity at its root remains insufficient, uncoordinated, or absent altogether. Meanwhile, public messaging continues to reinforce the disconnect. Most people associate obesity with heart disease and diabetes, but far fewer realize its role in cancer. National awareness campaigns rarely mention weight as a risk factor for cancer, even though it rivals or exceeds other well-known carcinogens in population-level impact. This silence perpetuates public misunderstanding and strips individuals of the knowledge they need to make informed decisions. Worse still, it reinforces stigma by implying that obesity is a lifestyle failure rather than a medical and societal challenge, deserving of support and structural change. Global disparities further compound the issue. In many low- and middle-income countries, cancer prevention is still largely focused on infection control and tobacco cessation. But obesity is rising fastest in these regions, fueled by urbanization, westernized diets, and increasingly sedentary lifestyles. Without timely policy adaptation, these nations will face an epidemiological transition where obesity-related cancers surge without infrastructure in place to manage or prevent them. Yet, international cancer strategies continue to underemphasize obesity as an emerging threat, leaving poorer nations unprepared. This policy vacuum is both preventable and reversible. National cancer strategies must be updated to reflect the evidence. Obesity is a major, modifiable cancer risk factor and should be treated with the same urgency as tobacco. That means dedicated funding lines for obesity prevention in cancer research grants. It means robust, equity-focused public health campaigns that educate on the obesity-cancer link without stigmatizing individuals. It means structural interventions that make healthy food affordable and physical activity accessible. And it means aligning fiscal policy, such as food taxes and agricultural subsidies, with cancer prevention goals. The science is clear. The cost of inaction is rising. And yet, obesity remains hidden in plain sight in cancer policy frameworks around the world. Treating it as a secondary concern delays progress, wastes lives, and erodes public trust. Obesity is not just a metabolic burden. It is a carcinogenic state. Until national cancer strategies reflect this truth in their funding, priorities, and messaging, prevention efforts will remain dangerously incomplete.